So now I request Dr. Venkatesh, he is the Chief Medical Officer of Aravind Pondicherry, to talk about understanding patient expectation and monitoring patient, how do you monitor the satisfaction as well.
Thank you, sir. Thank you for the opportunity. I'll just show you the next important part of it. Now, we saw in that pyramid how important is safety, and more important is how we are patient-centered care, because this is the foundation on which all your efficiency, effectiveness, and timeliness and equity is going to be there. So I'm going to share some of our experience on how we understand and how we monitor some of this, because you know what happens if people are not happy in your system. So what has stood the test of time for everyone, including Aravind, is, of course, what Shivakumar was beautifully talking about, the quality of surgical work, the ease and accessibility and affordability of the care, and also the compassionate care which we give to these patients. But why do patient expectations matter? It really matters, because what do they expect from us? That also we need to really understand sometimes on a day-to-day basis. And in this changing world, I'm sure in another few years you'll have a new generation of patients coming in. We should know what they expect from us. So they expect definitely a good quality of care, what the outcomes which they get. Very good communications from us, whoever is doing. When we are talking about this team, everybody should be communicating. Even your security should be communicating the right thing. And of course, personalized attentions. When it comes to elderly patients who are vulnerable, who need access to a lot of support, you need a personalized attention. So what happens when we meet those expectations? We have seen this. But this is quite rare. When they are really very happy, they go in and write somewhere, right? But if you don't meet, you won't have those satisfied patients who are reviewing for you. What happens if we don't? That's when we see all these reports. Even yesterday night, I was not happy in the place where I'm staying. The minute I wrote, that guy came to my room and he said, "I'll change your room." It happens, but sometimes, we'll have to keep listening to our patients also. So how do we know if they are satisfied? So what we are doing at this point of time is, we have a lot of feedback kiosks like this, like how you see in airports, in many places within the hospital. And then we have a dedicated call center, which is called a PACY, where PACY means it's like you talk to the dedicated call center person. Whatever be, you want to change dates, or you want to know when you can take your head bath, things like that to clarify. Because once it goes to an operator, then they are not connected, they are unhappy. And then, of course, through reviews. And this is one thing which has helped us, at least in the last couple of years, I would say. Once you register, you get a WhatsApp number. And when you are there, it is very easy to kind of satisfy them. So they can send a WhatsApp message of if they are waiting longer or somebody is talking rude, so that you can attend to it, than doing a postmortem later after seeing a review. And of course, some of these suggestions are very interesting. Like this is one thing which I got recently. It says, name board in the Kadalur to Pondi Road is not visible. Some trees are hiding the boards. Things like this, which you never even imagine, because the hospital, the entrance gate. But for him, it's saying it's hiding. And then when I went and checked, we had to chop off some of those branches to make it better. So some of these interesting things you get. And this is one thing which we do routinely for our cataract post-ops. Even whatever you have all these, these forms really make a difference. You can go virtually online, you can get even in your iPad and things like that, whether you're satisfied with your intermediate vision, your near vision, when you're doing a multifocal or an EDOF lens. And that really helps them to talk to them if they are not happy. And for every inpatient, surveying something like this, getting about how their outpatient care was, how their inpatient care was, how the other allied services, including your canteen, coffee shop, securities, insurance, everything matters. So I'll just share with you some of the insights we got from this feedback and how we have been trying to kind of work on it. One thing which we always get is long waiting times. I see some smiles here who are alumni of Aravind. They have pretty big smiles. When they say you come into Aravind or any facility, it takes 4 to 5 hours, long waiting times, more clarity in communication. I don't remember the post-surgery instructions, which the paramedic gave, and after I went home, I'm calling somebody or asking somebody. How do you improve on all these things? So especially COVID was a big learning. I'm sure many of you didn't want to let that good crisis go waste. We did a lot of experiments in Aravind, including something called scheduling, which we never did before because we were a non-appointment system. Everybody was walking in at 9:30, 10 and crowding the OP, and they were bottleneck at different points. So once we started scheduling, they got an entry time. It's an entry for registration, not to see a doctor. They were happily having their breakfast, having a coffee break, and then coming to the registration. And this really helped us. This is something like getting your passport scheduled time. Once you go in, you'll be done in another 1 hour. So the examination also happens in a couple of hours. Then we introduced something like a token system within the clinics to identify. Again, it brought a safety. Instead of calling them by name, we had a number display, and then they would just get up, and then we would go and attend to them. It made the job much more simpler. And counseling, this we realized during COVID that there was a big bottleneck in counseling, and then we realized 50% were other eye. Can we segregate them? Can we do them within the units than sending them to the counseling room? Because it's the same lens and the same procedure. And just by segregating, we were able to save a lot of time for that. So even if you do study and small analysis and then you do small improvements, you can definitely work on some of those long waiting times which our patients have. Especially this clarity in communication. It keeps on coming. Is the hospital and insurance company? No. We are just helping them to get the insurance. But they don't see you like that. They come and say, you didn't give me the money which I am supposed to get. So we just changed the name. This idea I got from one of my colleagues who practices in Karur. He said, it's an help desk. I'm not the insurance office. I'm just helping you. Just that name can change the mindset of your patients. I can tell you, just go and try this. If you say insurance office, say insurance help desk. You are helping them to get that insurance. And things like this will take a certain time, and then QR codes for taking the instructions of HFA and being prepared for the HFA or a OCT or whatever test you do. If you have very good videos, QR code really works. Something like this. Even if the patient doesn't know how to save, a paramedic help them to save. This is post-operative instruction, which is a 4-minute video. They scan, they save it, because the minute I go home, somebody else is the caregiver. If they go and show those videos, your calls in the post-operative period significantly reduces. So things like this can make a big difference. So wherever possible, now you know how people use these codes comfortably. Post-surgery instructions, hard to remember. A lot of calls keep coming to the call centers before, but now it has significantly reduced. This is a simple timetable we have introduced. This was an idea from one of the ashram patients who used to come. So can you give me a timetable? You are 8 times for 5 days, you are 6 times for 5 days. I'm not able to track. Can you give me something which I can tick? So she gave me a model. And I said, what a brilliant model. And we did with something like this. And it's really helping many of our patients. So even a simple timetable like this, it may look very subtle, but it may make a big difference. You won't get post-operative iritis, I'll tell you, because they are going to put their steroids properly. And all these little things matter. Can you get the audio? Boss. So if you see, this is one of the patient's idea, in fact. I'll just show you again what happens. See, she's ringing the bell. So every wheelchair has got a bell now. So that just is a simple idea from one of my patients. In fact, he sent the bell. So I was forced to put it into the wheelchair, and then we saw the difference, right? So whenever there is no way, you can just ring. It's like the airport buggy where you make a small noise to give the way. And this is another brilliant suggestion given by a patient. He said, Aadhar, they have a dual screen. Can you put a dual screen so that there are no errors in my name or the address you collect or the contact number? What a brilliant idea. And then you can see the QR code on the dual screen so that they can easily scan and pay their amount. Otherwise, sometimes you have to collect the phone and do all these things. So to know patients' what they need better. What we did was we significantly worked on this, looking at their needs in the near, intermediate, and distance. This really helps you to decide the lens. Many of the time, I think you would have seen in your practice, people come back and say, I didn't know what my lens was, right? Otherwise, I would have gone for the EDOF. I would have gone for multifocal. Can I know the needs of the patient? And I'll just show you a quick audio.
Cataract surgery has evolved, offering a variety of intraocular lenses to suit different visual needs. But with so many choices, how do our patients decide? At our facility, we simplify this process with a comprehensive needs assessment. Patients' daily activities, profession, and vision priorities are carefully evaluated, assigning scores for near, intermediate, and distance vision. Based on these scores, along with a thorough clinical evaluation and biometry, we recommend the most suitable IOL while clearly explaining its benefits and trade-offs. To enhance understanding, we introduced virtual reality counseling using an app developed by our team. With a smartphone and a VR headset, patients can see the world through different IOLs, experiencing firsthand how each lens enhances vision at various distances. Even if a patient's vision is limited, caregivers can step in, ensuring an informed decision. This technology also enables efficient counseling in our high-volume system, ensuring that every patient receives clear and informed guidance. Following this intervention, we had a significant increase in uptake of premium lenses in the last couple of years. Through this innovative approach, we empower patients to choose an IOL that truly fits, bringing clarity, confidence, and the best possible vision.
So you have to remember the caregivers are the next generation. They are ready to use all those technology. You can think how the patient can feel, but they can feel what their parents can see after surgery, especially if you're going for EDOF or multifocal or even a toric lens and how astigmatism is. So all these things, I think once you start seeing as a practice, you can see a big change the way you deliver some of your surgical practices also. Before I complete, I'll just show what is happening here. So this is actually my caregivers of cataract patients. Every day there are at least 15, 60 or 70 caregivers of your 70 to 100 day cats. So what do you do them? They are watching all around. They are waiting to write your reviews if they are not going to be happy. So how do you engage them? We had a beautiful campus to engage them. So what we are doing is we are doing something called a green tour, where they're taking them on the facility tour, showing them some of our green practices, showing them how we are eco-friendly, the glass bottles which we have here. So he is one of our fire officer who is trained to do this, and he knows in and out of all the trees and plants there. I don't know, he's like an encyclopedia. So he takes these patients, caregivers, who are mostly young people, on a tour like this. He tells them how much of solar energy we generate, how much water we recycle, how much water we harvest from the rain. Because all this, he's got data in his hand, and then he goes around, shows them with some information. So we have some information boards there. This is about the solar. We generate 540 kilowatts, which is almost 65% of the needs in Pondicherry facility. And then he shows the DWatts plant, which recycles water. Almost 90% of water is recycled. And after the surgery, I see more feedback on him than the surgeon or the surgery. Okay? So many people write, we had something useful I learned today. How much of solar we can generate at home. And he also kind of introduces them to the people who do us for us through the Auroville team. But few things like that you can see, and this definitely shows how the data, this is a year data looking at outpatient, other services and inpatient. If you see, there is a subtle difference, but the orange is becoming more blue. That is the most satisfying part. There's becoming more excellent now. And if you see the average and the poor is significantly reducing, and mostly those are in the canteen, coffee shop, where I'm not able to really take care of all the taste buds. But definitely we have all these future plans. I'm not going to bore you with this. I'm sure you'll all be exploring all these AI chatbots and things like that. But I think the patient-centered care and listening to patients and making sure you bring some of those practices and showing them you are really listening is very important in taking your care to the next level. Thank you.